It's getting worse. This war is going to take weeks, if not months.
When you first started your video diaries, the situation obviously seemed very dire. So compare that to now for us.
Our volumes overall have been much lower than they were even last week. And even outside of the emergency department, you can feel this gradual sense of persistent anxiety, but a gradual return to a possible new frame of normalcy.
The unit that I work in is a COVID quarantined critical care unit, highest acuity, sickest patients that we have in the health system right now.
We've learned about medications that we thought would work that we know now are not working. We've also learned of using convalescent plasma for people that have survived the virus to try to help people overcome the virus. So we're doing that now. Every day we learn new things and new medications, and trials are coming out to try to save lives and help fight the virus.
Well, what can I say? It's the end of the shift. Saturday, April 4th. Just a horrendous shift.
The biggest challenge was being able to communicate adequately with my patients and their families. It's hard enough to do to talk about difficult things like putting a relative on a ventilator and what their prognosis is like. It's even harder to do it when you're garbed in PPE, 3 and 4 layers deep.
No matter how many times I work a shift, the one thing that always comes to mind about this disease is how lonely it becomes. I was crushed emotionally. There was really no end in sight at the beginning of this. And that made it much difficult to see the light at the end of the tunnel.
Some people didn't make it today. And I guess that's just, we did our best. That's all I can say. It's not been a good day.
At what point would you say was probably the darkest part of this process for you?
Probably the worst part was being with folks who were seriously ill. And I could recall a few who were dying. And the last person that was with them when they died was me. Mm-hmm. And just trying to offer them solace and keep them connected with their families was difficult to do.
I have some tears and crying right now because I'm so tired. But I'm going to take a deep breath and keep going on. I think I just needed that, a little let down. But now I'm going to continue on and powering through back into the unit.
Healthcare workers and hospital employees will definitely come out of this stronger. We've been to war. We've been to war together. We've been to war supporting each other. We've emotionally broken down together and lifted each other up. We will definitely be stronger after this, more united after this. Nothing could go back to normal after seeing what we've seen and been through together.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.